All right, so my second case study is with Susan. She's an Israeli woman who is Jewish and tries to eat as kosher as possible, which is the information that we got. She came into the hospital because of a squeezing chest pain that led into her shoulder and into her neck as well. She had shortness of breath, nausea, sweating, and her heart was racing. So they tested her and it showed a STEMI, which is a serious heart attack caused by a completely blocked artery. And the blockage was in the LAD, which is the main artery in the heart. And the doctors went in, put a stent in to keep the blood flowing, but they also found another narrowed artery as well. And it's slightly pumping below normal ranges. She also has high blood pressure and high cholesterol. So my first assessment would be to make sure that she is stable after procedure. She just had a large surgery and she's NPO, which means that she cannot eat or drink water or any kind of liquids until the medical team says it's clear and safe. So we're just gonna check in on her, see how she's doing, where she's at, how her appetite is, how her swallowing is, if she's ready to learn about these new conditions and all the things that are going on, because she's probably pretty overwhelmed. But I do want to review her blood pressure, her cholesterol, blood sugar, and see how her kidneys are working, and just medication. So go over that whole assessment with her afterwards if she's up and ready. If not, just go in, introduce, see how she's doing, check in, and check back later to see if she's ready. So she is 173 pounds and 64 inches tall, so she's about 29.7 for her BMI. But weight loss is absolutely not our priority right after a heart attack. It's to give her some space to be stable and to really recoup after this. And then we're gonna ask her about her normal weight, what her usual diet is, including like vegetables, fruits, whole grains, protein sources, what she uses to cook with, how salty or processed her foods are, alcohol. All of those questions are baseline that we need to see. And like who prepares her meals, what's like is cost and something that affects them, how much access do they have to food, what does their kitchen look like. So all of those baseline things before we start building on the other, but just start working on those assessments and getting to know what their culture of food is in their house and see what that looks like for her to see how we can best help them. So for this, I would say she has elevated lipids, and a heart attack is caused by a complete blockage that requires a stent. So cholesterol and heart disease show heart protected nutrition should be a part of recovery. So there's lots of things that we can go into for heart healthy things that we can look into for her, including healthy fats, what kind of foods, like cutting out a lot of the butter and the fatty meats and all of those things to help with the heart. So I would get those things from the American Heart Association, which I have an infograph for. But while she is NPO, we will not be providing food. But after she is stable and cleared to eat, I would recommend heart healthy patterns to fit her kosher practices. So like I said, this diagram will show the American Heart Association's diagram, including balanced meals that have fruits, veggies, whole grains, healthy proteins and fats. Options include like Israeli salad, roasted vegetables, lentils, beans, kosher fish, skinless poultry, barley, quinoa, olive or canola oil to replace butter and fat. I would also encourage just like less sodium, processed meats, added sugar, and just those saturated fats as we're trying to have some healthy hearts and move away from those very saturated fats as well. I would select 2 realistic goals for her upon discharge or before discharge, adding either a vegetable to dinner or lunch and replacing butter or fatty meat oils with olive or beans, fish, and poultry. So trying to do that, like fatty meats as well, like replace those. I would ask her to explain in her own plain words what we're working towards and why we're working towards it so that I make sure that she understands. I think the cultural competency here is that not every Jewish person practices the same thing and they have different rules and different things. So asking those questions of like how she practices Sabbath, does she separate her meats and her dairy, and like how do holidays affect meals and what she eats, and just getting to know more of what her culture looks like, because it's not black and white, especially with the Jewish culture. So I would ask if she wants her husband to be involved with this process, and I think we need to address the barriers as always, the medication costs that are going to come with this, the transportation to rehabilitation, the access to the kosher foods that we need, what work demands for her, how much information that she is receiving and how overwhelming that can be. So I would just monitor in the hospital her tolerance of food once she's allowed, and her nausea, her intake, her weight, all of those things, and just look at the kidney functions. But I would also want to look into her blood pressure as well and just check in with how her rehab goes.